Good afternoon and welcome to the COVID-19 update on Channels Television. I am Kayode Okikulu. Here are some of the highlights. Apparently irked by the enforcement of COVID-19 protocols banning festivals in Ekiti State, some youths attacked Monarch's Palace, leading to the death of 2 persons. As graduating secondary school students get back to their studies nationwide, the Ebonyi state government promises to provide over 38,000 students and teachers with personal safety kits. And Russia announces world's first COVID-19 vaccine, which it says is proven to be highly effective and safe, even though trials are still underway. Thank you for joining us. 290 new cases of COVID-19 in 24 hours brings Nigeria's tally to 46,867. Latest figures from the NCDC shows that 7 out of 10 of this national total have been discharged. That's nationwide. 12,571 remain active, while 950 people have succumbed to the deadly virus. A breakdown of the latest figures across states shows that 15 states and the FCT account for Monday's positive cases. Lagos and Plateau recorded 82 cases, Oyo 19, FCT 18, Edo 16, Kaduna 15, Enugu and Ogun 9, Kano, Kwara 8 each, Cross River, Ondo 5, Rivers 5 each, Ekiti 4, Imo 3, and Borno 2. A total of 319,851 tests have been conducted nationwide, and that's about 1,600 tests per million people. Simply put, only 0.16% of Nigerians have been tested for COVID-19. Well, the Presidential Task Force on COVID-19 is not too pleased with the level of compliance to COVID-19 protocols during the ongoing political campaigns in Edo State and the burial of Senator Buruji Kashamu in Ogun State over the weekend, where crowds gathered in their hundreds. At its national press briefing on Monday, the PTF said it was dismayed by the crowd's failure to maintain social distancing and wear face masks. The national coordinator of the PTF, Dr. Sani Aliyu, who referred to the wearing of face masks as an act of kindness, asked governors, leaders, and civil authorities to ensure that situations that pose a risk, such as mass gatherings, are avoided. Well, it's a sad day in Ekiti, or a local government area of Ekiti State, as some violent youths attacked the palace, leading to the death of 2 people. The violence reportedly erupted as a result of the monarch's refusal to allow people gather in their large numbers to celebrate the annual Ogun festival, a request the monarch describes as contrary to COVID-19 protocols and government rules. The police public relations officer in the state, Sunday Abutu, confirmed the deaths resulting from the violence, which saw the destruction and burning of the monarch's palace and property. The initial police team deployed to calm the situation could not contain it, but succeeded in whisking the monarch away to safety. The chairman of a state task force on COVID-19 also condemns the development, stating that relevant authorities will swing into action to restore normalcy to the town.
There is a political undertone. There is, because the moment they when they went away, they came back with another formula more than 6-7 times. I said no, somebody is engineering these people. Somebody is motivating them. Go and do this. I could sense that. It has a political undertone. I'm sure of that. I sensitize them. Look, this thing is real. It kills. But they don't want to know. They don't want to even hear. I don't know why. Though the state government is aware of this, is aware of what is happening now, so I'm still expecting them to do more. Because right now I need them in my community.
Anybody who does that, and because he's unhappy that somebody is trying to control what the government has set, he then goes against it, then he's in violation of the law.
Let's head over to Ogun State, where the government is refocusing its attention on agricultural development and its value chain to revamp the state's economy, create employment opportunities and food security in the post-COVID-19 era. The state flagged off the harvesting of 125 hectares of its wet season rice plantation cultivated by young rice farmers at the beginning of the outbreak of the coronavirus pandemic. The state governor, Dapo Abiodun, represented by the State Commissioner for Agriculture, Adeola Odedino, says that the administration is committed to encouraging more entrants into agriculture and its value chain through mechanized farming.
We are witnessing the benefit of the smart decision made by His Excellency, the Governor of Ogun State, Mr. Dapo Abiodun, at the onset of COVID-19 lockdown, that agricultural activities must continue in the state. Gentlemen of the press, we were here when this youth started this venture in March, and we are proud as a state that we are harvesting, and all other farmers around here are harvesting. As they are harvesting, other people are planting. And agriculture in Ogun State is technology driven, and this is a youth group and is under a youth focused agriculture. You've seen the excitement of using mechanical harvester. We also planted mechanically. These youth are making good money in Ogun State. Rice business matter, and this is a way of encouraging the youth to embrace agriculture. If you are doing youth focused agriculture and you are not doing mechanization and ICT, forget about it. So our rice anchor border program is also based on technology. This is also extraordinary. This is in addition to the over 1,200 farmers we are empowering under Anchor Borua program.
Elsewhere in Kaduna State, the private sector coalition against COVID-19, COVID, is distributing palliatives to indigent and vulnerable persons across the 23 local government areas of the state. At the event held in Igabi local government area, the state deputy governor, Hadisa Balarabe, commended the COVID team for pooling resources together to help the downtrodden in the society. The Deputy Governor, Hadiza Balarabe, also disclosed that the state government has reached out to thousands of households across the state since the outbreak of the pandemic. The offer of food items and medicals to vulnerable states, according to a member of the COVID team, is to strengthen their response capacity and outright building of isolation centers across the 36 states and the FCT.
On April 1st, 2020, the state commenced the first phase of distribution of the palliatives in 9 urban local government areas within 62 clusters. And on the 20th of May 2020, the second phase of the distribution covered the other 14 local government areas, with 32 clusters benefiting from this phase. This initiative by COVID is most welcome and sits well with our quest as a government to provide relief to low-income and vulnerable individuals and households. I assure you that our State Relief Distribution Committee, which is chaired by the Secretary to the government, has put all necessary machinery in place and will continue to do its utmost best to deliver these donated food items to the intended beneficiaries across the state.
COVID, in collaboration with the state government, has commissioned 38 isolation centers across the 36 states in Nigeria and the Federal Capital Territory inclusive. The coalition has also improved the testing capacity of the NCDC with the donation of over 100,000 testing kits and various PPEs. Today, we have commenced the third phase of the intervention plan in the fight to combat and eradicate COVID-19 in Nigeria. COVID National Food Relief Program, which will see the distribution of various food items to over 1.8 million families, that is over 10 million Nigerians across the country.
Well, Dr. Dayo Ajibade is a medical doctor, a health educator, and founder of Brain and Body Foundation. He joins us live from our Abuja studio to discuss some of the latest developments in the nation's fight against COVID-19. Good afternoon. Thank you for joining us. Hi. Well, Dr. Ajibade, the pictures coming in from Ekiti State, let's start with that, is quite worrisome. And clearly, it appears as though we have a long way to go in sensitizing people, especially at the rural areas.
Yes, it is a big, big problem. I traveled recently to one of the northern states around here, and almost no one, in fact, no one except me and the person I went to see were wearing masks. And I mean, you see them in their large numbers. So it is a challenge. Of course, part of it is because of the cultural beliefs. Others simply don't believe it exists. They think it's some kind of propaganda. And others just believe that it's not going to happen to them. So there's still that challenge of being able to convince people the reality and the seriousness of the situation. So it's still a big challenge.
You know, yesterday the PTF pointed out that messaging and consultations will continue. In fact, that was one of the key messages at yesterday's briefing. So what model do you think we can adopt in passing this message across to those who hold, for example, primordial sentiments very strongly?
We need to go through the existing authority lines, the chieftains, the emirs, the local leaders, go through the radio waves, the formats in which the individual communities the individuals in the communities can respond to. Simply on TV alone may not always be able to pass the message across, and so there has to be that more extended grassroots approach so that people can really understand it. In addition, people need to understand the severity of the condition. Maybe even showing some graphic pictures or showing how people like them have died from the disease, because I think that's really what gets to people. Just talking about COVID-19 to many locals may not really have the impact that it needs. So I think there has to be more aggressive grassroots mobilization.
Well, we'll talk about Nigeria's latest figures in a moment, but the PTF also referred to the recent political campaigns in Edo State. I'm sure you've seen visuals coming in from Edo State, from both major, the main party and the opposition party. You see people, disregarding physical distancing, not wearing face masks. Is there really a solution to that one?
It's hard to get, it's sometimes really difficult to get through to people. We need to not relent from all the activities of trying to get the information across. But in addition, I would also say, in addition to the non-pharmaceutical methods of face masks and social distancing, people need to understand how to strengthen their immune systems. And this is something that is talked about a lot. We know now in retrospect that vitamin D, they found out that the most severe cases and the ones that die, the ones that result in death, they all have this in common. They have low vitamin D levels. So I think that would be a start to also educate people about some of these other non-pharmaceutical methods, so that, not as an excuse, they still have to wear masks and they still have to social distance, but they need to also be able to take care of themselves and their families, just in case they're not able to get to an isolation center in time, or not be able to get a treatment center in time. So they need to be able to protect themselves and their families by using some of these things we have found out in the last few months that can help in the fight against COVID-19.
It's been long 5 months of this battle, but, Nigeria recorded 290 cases yesterday, which is our lowest in a while. But when you hear the SGF, for example, say that for every case detected, there may be 7 other cases that we missed. So how should we handle these low figures, for example?
Some say it's about as much as 10 times the numbers that is the reality. Some say as much as 50 times in other countries. So I personally still believe we as Nigerians in Nigeria are much more fortunate than the Western world. It certainly has not been as severe in this part of the world than others. However, that should not be a reason for us to relax. We should take the numbers. They are still numbers, and the proportions are still pretty accurate. And we know that 80% of people who get the disease or who are tested will have minor to moderate to minor illnesses, and they'll come out of it. The problem is that these people can spread the disease to those who are elderly and more immunocompromised or more susceptible. And that can be what kills them. So it doesn't matter how low the numbers are. We need to always be aware that it's not just for ourselves, we're protecting ourselves. We're taking these measures. It's also for those who are more vulnerable, like the elderly, the obese, those with hypertension, those with cardiovascular disease. That's extremely important. And we've lost quite a few people because we thought it was not as dangerous as the media has put it out to be.
Well, I'd like to thank you so much, Dr. Dayo Ajibade, a medical doctor, a health educator. He's also the founder of Brain and Body Foundation. Thank you for your thoughts this afternoon.
Thank you so much for having me.
Well, has Russia developed the vaccine for COVID-19? Well, the government certainly thinks so, but we'll bring you other angles after the break. Please stay with us. Welcome back. Well, it appears as though efforts made by residents of Bayelsa State to abide by the safety protocols of the NCDC is beginning to pay off, as the number of coronavirus positive cases in the state is reducing on a daily basis. Our correspondent, Dobra Timiwood, has more.
As of today, there are 14 active cases for the coronavirus in Bayelsa State, and that is cheering news for residents of the state. Some believe that this is due to the fact that residents of the state are very conscious of the virus and that has reduced the spread of the virus, while others believe that people no longer present themselves to testing centers to get tested.
During the inception of the first case in Bayelsa, at least the government of Bayelsa State and the state task force, I think they swinged into action, trying to make sure that it didn't escalate, and it has been paying off.
COVID-19 patient in the state is reducing drastically. I think the government needs to be commended for the effort they are making. I think one of those efforts they are making is social distancing and wearing of a nose mask. I believe that most of us are not reporting, ourselves as having strange feelings of maybe high fever or whatever.
Out of the 346 confirmed cases of coronavirus in Bayelsa State, 311 have already been discharged. 21 deaths have been recorded in the state, and as I told you earlier, there are only 14 active cases for coronavirus in Bayelsa State. From Yenagua, Dobra Timiwood for COVID-19 updates.
Well, in Ebonyi State, the government is promising to make available personal protective kits to at least 38,000 students in exiting classes, and that's across the 13 local government areas of the state ahead of the WAEC examination. Governor Dave Umahi disclosed this at the Ecumenical Center in Abakaliki, the state capital, during a sensitization program organized by the State's branch of the Nigerian Union of Teachers, NUT, on safe reopening of schools. Governor Umahi said the essence of the sensitization program is to educate the teachers on safety precautions and the importance of adhering strictly to the COVID-19 protocols during the forthcoming exams.
This program is designed to train our teachers on the dangers of COVID-19, how to manage school during a pandemic, how to manage student-teachers relationship during pandemic, how to conduct exams during pandemic. That's exactly what this is all about. Of course, hand sanitizing, social distancing, all these things has all been going on in Ebonyi State. But this is a special program for the teachers, invigilators, supervisors of these exit classes that were reopened in Ebonyi State. Special in the sense that we are bringing the children for the first time since this pandemic together. We need to design certain protocols that must be observed in our various schools. For instance, in Ebonyi State, we are reducing the time we are going to keep them together. For instance, if school was to be 6 hours, we are bridging it from 8 to 12. This training will provide the teachers and the principals and junior head principals opportunity to synergize with these health workers.
So let's speak with Dr. Gertrude Chimeka Ayawoke, who's an infectious disease specialist. She joins us via Skype from Baton Rouge, Los Angeles, in the United States. Thank you for joining us today. Well, we'd like to start with global trends. Great to have you. Let's start with global trends. And it appears as though the race to vaccine has been won by Russia. In fact, President Putin said that his daughter had taken the vaccine and she's doing fine. Well, how does that hit you?
Well, whenever we hear that a vaccine has been produced against this deadly virus, we can only be happy, because it's like we're moving forward in terms of getting one over the virus. However, we have to be very careful. We have to be very, very careful, because there are rules that are set in place even before this vaccine, this COVID-19, where you think about the guidelines and the regulations. You have to follow those rules. Usually you test a hypothesis, you do test tube, and then you go into animal trials, and then you go into human trials. With the human trials, you have to do phase 1, phase 2, and then phase 3. Phase 1 is a smaller set of people that you get in, and to find out, a lot of times you try to find the efficacy and the safety. As far as I know, the Russian vaccine hasn't been through phase 3. Usually you have to get the vaccine through phase 3 with a larger set of population, thousands of people, before you can come out and actually register that as a good candidate vaccine for whatever illness. We understand that the need to rush through this stuff, but we have to be very careful, because if we don't make sure that that vaccine is safe and efficacious for the purpose, we just may be defeating the purpose.
You know, there's a medical side to this and the political side also. And the big question for a lot of us is, how does Africa play into all of this, really?
And that's a very good question. As far as I know, and I'm going to speak about Nigeria, because that's, you know, I'm originally from Nigeria. Yeah. I do not know any preparations that we've made in terms of maneuvering and being part of all these candidate vaccines that we've heard of. A lot of governments all over the world are putting in a lot of unprecedented funding and research into the different vaccine candidates. I know at least 139 vaccines that are being touted, and about 26 of them are in phase 1, and I think we have about 6 of them in phase 3. I do not know any one of them that Nigeria is involved with. We need to strategize ourselves into getting be part of the people that are being considered for vaccination when this gets available. And so I think Africa is way behind in terms of this.
We'd like to thank you so much, Dr. Gertrude Chimekayo-Oke, an infectious disease specialist. Thank you for your thoughts today.
Thank you for having me.
So yeah, Russian President Vladimir Putin has announced that Russia has registered the world's first vaccine for coronavirus, despite earlier skepticism from health experts and a warning from the WHO to follow established protocols. The country's health minister has declared that the vaccine has been proven to be highly effective and safe, and President Putin says it had passed all the required checks. We'll take a look at our website, channelstv.com, which has the latest updates on the pandemic. And all you need to do is log on and access the news in health, politics, business, and other areas you might find interesting, all at your fingertips. Well, that's the COVID-19 update for this afternoon. Thank you for watching. I am Kayode Okikelu. To stay safe.